I died. On the night of January 30th, 2019, I ran a quick errand to the gas station to get my son an icy. I had a stroke and flipped my car into a ditch, causing a spleen laceration, making me bleed out. It was the whole blood given to me on the ambulance that caused me to come back to life, giving my boys their mom back.
Tiffany Kishnick was the first traumatic cardiac arrest patient to receive whole blood from the Heroes in Arms program. She would not have survived without whole blood being given to her on the scene of the accident, and that stabilized her enough to get to surgery at the trauma center. The Heroes in Arms program is a special program we collaborated with other trauma leaders and medical community members to have blood where it's needed, where trauma might happen. So on ambulances, helicopters, for those who are experiencing traumatic hemorrhage.
Bleeding to death is the most common cause of death, the most common preventable cause of death in those patients.
Low-titer O-positive whole blood is used on those in hemorrhagic shock. So if a patient bleeds out whole blood, we should put whole blood back into that patient.
Blood in a modern healthcare system is broken down into its components. Oftentimes the best, like giving me one product for what I need, it's a perfectly great strategy. If the patient is bleeding, getting the red blood cells and the plasma and the platelets is the most beneficial to me because I'm getting the red blood cells to carry oxygen to my tissues, I'm getting the coagulation factors to help my blood clot, and I'm getting the platelets which help my blood clot.
O-negative blood is a universal blood type, but O-positive can also serve as a universal blood type if it's specially screened against certain antibodies.
The criteria to participate in the Heroes in Arms program, first is a heart of service. You are truly serving your community. You're serving San Antonio, South Texas with your life-giving donation. Beyond that, you need to have low-titer O-positive whole blood.
So the benefit to the Heroes in Arms program of expanding to women donors is you increase the donor pool.
On an individual level, when you give blood to a patient that is in hemorrhagic shock, we have had patients go from being dead to alive.
You really never truly know the potential impact of that one donation. It quite literally can save someone's life when they need it the most, on their worst day ever.
It's donors like yourselves that provide San Antonio with your whole blood that is a true hero.
There's an old quote, "It's beautiful and best of all things for those who work for the relief and cure of suffering." And that's what I love the most about the program. It's everybody coming together in the best interest of patients in South Texas.
My ask of you is to become a donor and help save a life.